Okay, welcome back, class. So now we'll go for the last part of our today's class. So before that, we have finished a case history, life example, and soap notes. How to take soap notes for history taking. And then we have started dental caries here, and we studied parts of tooth, crown, tooth, and pulp chamber, and what is cavity, how it is formed, and what are the main causes of cavity formation, which is tooth surface. There should be enamel and dentin. If there is none, it's already caries. It's already dental caries, so there should be enamel and dentin to form dental caries. And then there should be caries causing bacteria. We will also study in the oral infections, and streptococcus mutans should not forget, and lactobacillus is of course. And then fermentable carbs, carbohydrates such as sucrose should be there, and time is required. So starch or sucrose or any sugary food. Okay, so it depends on your poor oral hygiene, deep tooth crevices, poor eating habits, a lot of drinks, dry mouth issues, tooth grinding, attrition, and then aging. With age, the wear and tear is natural. And then we had some stages of caries development, which were the healthy, started from healthy tooth, then deep caries containing enamel and dentin caries, leading to pulp, causing pulpitis. And then there was root canal involved. And then we had periodontitis, which was abscess formation. These are again the same. And then we had two types of dental caries, enamel caries, dentin caries. How many are there? 32 students are there. And enamel caries and dentin caries. And then we have a clinical features of dental caries. It's usually asymptomatic, but dentin has some nerve endings in dental fluid of the dental tubules, so it can be painful. Then it starts with a white spot, then area of demyelination of enamel, and then it changes into brown and turns into cavity. If before cavity, if we take care of it and close it, then it's reversible. But if once reached to the stage 3, 4, 5, 6, it's irreversible because cavity is formed and it cannot be regenerated. And how to distinguish is brown and shiny regions suggest the dental caries was once present, so it's an old caries, and brown spot that is dull is appearance of active caries. And once the decay has passed through enamel and dentin, then there will be toothache, and the pain may worse on the exposure of heat, cold sensitivity, or sweet food and drinks. And then the dental caries can also called halitosis and foul taste, halitosis, bad breath. And complications include CST, cavernous sinus thrombosis, and Ludwig's angina. LA can be life-threatening. Should not call LA because LA is used for local anesthesia. So CST and Ludwig's angina. And then we studied what is cavernous sinus thrombosis, what is the facts, history, diagnosis and treatment, and then what are some differential diagnosis of CST, and then Ludwig's angina. What is this? It's cellulitis. It's superficial. It's non-suppurative. It's inflammation. It spreads along the subcutaneous tissue. It is the number one risk factor for tooth caries in Ludwig's angina, and it clinical features are hope, and management is rest, antibiotics, appropriate IV fluids, tube feeding, and surgical intervention if required. So Ludwig angina is not an angina. It's an inflammation of subcutaneous tissue, superficially, non-suppurative. And then we went for sign and symptoms, which were according to the enamel and dentin. Enamel usually do not produce symptoms, but dentists cause some pain, firstly by sensitivity of what called sweet and then sweet foods or beverages, contact involved with food, and later with the chewing and percussion. Pain can be intense and persistent when the pulp is severely involved. So what were the warning signs of cavities? If there is consistent toothache, if I want you all to know this, if this is consistent toothache, if there is increased tooth sensitivity and pain, sensitivity means thermal sensitivity, and if there is noticeable holes apparent to the naked eye, and if there are pits in the affected tooth, these are the warning signs that the cavities can be formed, and once the cavity is formed, it's irreversible. That's why the warning signs are used. And then we went for diagnosis. We can do it by inspection, and electrodontometry, partial staining, probing of tooth tissue, percussion elimination method, thermotest, and roentgenography. And then inspection is done by good light source, dental mirror, and explorer is used. Dental x-rays are used. Large dental caries can be seen with your eye because they are large enough. And then you can use visually in your eye, and tactile mean percussion inspection along with radiographs to reach to diagnose and diagnose pit and fissure caries. And then we studied a table by the International Caries Detection Assessment System, ICDAS, and then ICDS or ICDAS, and then we had 6 stages. 0 means none, and 6 means very heavy cavitation. And then 1 and 2 stage were initial lesion, moderate lesions were 3 and 4 stage, and 5 and 6 were extensive lesion. And according to diagnosis, there were some treatment, includes secondary prevention and tertiary prevention or care. Now we start with another table, which is American Dental Association Caries classification system. If you don't follow that, ICDAS, you can follow this, but you need to name them wherever you are following. And then we have clinical presentation. If your teeth has this clinical presentation, is safe and sound, is healthy, these are same initial, and then moderate and advanced. Basically both are same, but some of them things are not there, and this they have radiographic presentation here. So as you can see, clinical presentation of healthy teeth are no clinical detectable lesion, naked eye and x-rays, and dental hard tissue appears normal in color, translucency and gloss is there, and there's no white spots, no surface change or adequately restored. Infected dentin, of course, enamel is intact, so we cannot see dentins, so none. And this is ICDAS 0. And you can see the smooth surface. This is a smooth surface, it's not rough, and there is no inner lesions present. And now when we go to the initial ICDAS 1 and 2 stage, there are a lot of lesions there, and there is surface is rough, and there is discoloration, it's not shiny, this is not glossy. And we have seen some minute yellowing or blackish cavities formation. And then you can see here, okay, let me show you. If you can't see, some of you, here the cavities start forming, you see interdental, and this is going inside towards, right? So this is a cavity formation. You can see here is big, or I should do like this. This is cavity formation, and this getting bigger and bigger, reaching to the pulp, is reaching to the pulp. Yeah. Okay, so this is ICDAS 0 to 6 stages, whereas stage 1 and 2 are initial, stage 2, 3 and 4 are moderate, and advanced stage 5 and 6. And initial stage, the dentin is not unlikely involved. Moderate, the possibility of infected dentin or dentin caries are possible. And advanced, of course, definitely it has almost reached to the pulp. It's almost reached to the pulp. Enamel is fully cavitated and dentin is exposed. Dentin region is deeply, severely demineralized, but has not reached to the pulp, because if it reaches to the pulp, there is inflammation, there are arteries, veins, there's blood vessels, there's inflammation, inflammatory cells, pulpitis. But we are talking about caries system, so they should not be pulpitis. We are just stick to the caries. Perfect. Next. So now we go for the treatment. This is extensive treatment. Let's start our dental caries treatment. Before definitive treatment, here are some ways to ease the discomfort for the dental caries. Avoid foods and beverages that are very cold or hot. So we need to avoid the pain, basically, right? Since the dentin layer of the tooth has been invaded by the tooth decay, extreme in temperature may cause pain. And avoid foods and beverages that are very high in sugar or acidic. So we need to avoid sugary foods and beverage, and the carbs, to avoid cold and very hot sensitivities, and extreme in temperature, which can cause pain. And then we should avoid sugary food and acidic foods, and use an over-the-counter pain relief medicine. Over-the-counter means easily available without prescription. OTC, over-the-counter, means prescription is not required by the doctor, and you can go to the chemist to buy these pain relieving medicine like paracetamol, right? And then we have on the right side, we have some Caries treatment, which includes ozone therapy, O3, laser treatment, filling, air abrasive treatment, and infiltration. Okay, next. Try flossing between the teeth that are painful to remove the food particles and plaque, which may be help to reduce the pain from the toothache. Try using oil of cloves, eugenol. What is eugenol? Eugenol is an oil of cloves. Eugenol is used in various dental materials because of its antiseptic and anesthetic properties. Eugenol has antiseptic and anesthetic properties. Using eugenol at home may help reduce pain from a toothache. May. So our still hope, if you really have to toothache and you are not, is not solved by eugenol, go for NSAIDs. Soak a small piece of cotton in the oil. How to use eugenol or oil of cloves? Soak a small piece of cotton in the oil, then cut the cotton on a piece of tissue to remove the excess oil, and hold the cotton on the painful tooth for 10 seconds, making sure you do not swallow any of the oil. Do you know cloves? There is like this seed, peppercorn, and then clove, right? So that's a clove. Okay, so you have oil for that and eugenol, and then you use, this is the method to use eugenol. Okay, perfect. Is black in color, remember? Okay, seal the hole temporarily. So one of the treatment is you can seal the hole temporarily. Some pharmacies have over-the-counter temporary filling material. Over-the-counter temporary filling material that may be used to seal the hole created by decay temporarily. What happens is, if there is cavity and you seal the hole with the over-counter filling, then it prevents further cavitation, and you can go to the doctor or dentist to take care or to get the treatment. And now they say, do not delay. A toothache that is caused by tooth decay may come and go, but do not delay, because you do not delay going to the dentist. The longer you wait to have the decay removed from the tooth, the deeper the cavity will progress. So the longer you wait, so the decay will be more and deeper the cavity will be formed. What may have been a need for a simple filling could turn into a necessary root canal or even extraction. So if you delay, the decay is more, and where there was simple filling required, now you need root canal or even extraction because of your delay. So do not delay. As soon as you develop a toothache, see your dentist immediately. For small lesions, topical fluoride, which is usually used, which is formed in toothpaste. We have toothbrush and there is toothpaste. The toothpaste have topical fluoride, is sometimes used to encourage remineralization. That's why for some patients, if it's superficial cavitation, they brush the teeth, and after some time, surface layer is formed of the topical fluoride, and then their pain is relieved for some time, because some fluoride, some toothpaste have some anesthetic, antiseptic in them, which is safe for teeth pain. Then there is definitive treatment. Definitely we need to know the definitive treatment is very important. It's definite because it's definite. Early treatment is less painful and less expensive. Early treatment is less painful, less expensive than treatment of extensive decay. So there is anesthetics, there is dental drill, and there is restoration. Anesthetics, for example, local nitrous oxide and other medications may be required in some cases to relieve pain during or following treatment, to relieve anxiety during treatment. So sometimes they use local anesthesia and some nitrous oxide. If prolonged treatment is required, or the treatment is long for certain hours, then they use nitrous oxide, laughing gas, and other medication. A dental drill is used to remove large portion. So when you go to a dentist and they have an irrigation system, that is known, that process is known as the whole instrument is known as dental drill, which can, you can change the heads with it. It's used to remove large portions of decayed material from the tooth. A spoon, a dental instrument used to carefully remove decay, is sometimes employed when the decay in dentin reaches near the pulp. So dental drill is used, first we use anesthesia to relieve pain or to relieve anxiety during treatment of the patient. And then we use dental drill to remove the large portion of decayed material. And sometimes a spoon is used, which is a dental instrument, to remove decay carefully if it is reached the pulp. So spoon is used if the decay has reached the pulp, near the pulp, not the pulp, near the pulp. Once the decay is removed, the missing tooth structure requires a dental restoration to return the tooth to functionality and aesthetic condition. So usually we cap it. The tooth is usually capped with a crown cap or any cap, steel cap, or different types which are non-allergic to the oral cavity of the humans are used. And then definitely we go to the restorative materials. What are the restorative materials? What are the fillings? They include dental amalgam, composite resin, porcelain, and gold. Yes. So composite resin and porcelain can be made to match the color of the patient's natural teeth and are thus used more frequently when aesthetics or beauty are a concern, or facial features, beautiful features are concerned. So when aesthetics are concerned, composite resin and porcelain can be used because they can be used to match the color of patient's natural teeth. In certain cases, endodontic therapy, also known as root canal therapy, RCT, may be necessary for the restoration of tooth. So on the right side, now see the treatment options for dental cavities. Yeah, so these include pits and fissures, sealants. People with deep crevices on the tooth surface can seal it to avoid the risk of developing dental caries. Those people who have gaps or crevices, because gaps or crevices expose the teeth to the surface more, the area surface which is exposed is more. That's why they can use some sealants to cover that area to avoid the unnecessary surface area, because only surface area which we need to expose of our teeth is for tearing or grinding or cutting. So we do no need for crevices, deep crevices or pits. And then composite. What is composite? Composite resin. Composites are tooth colored materials. So composites are some compounds which are tooth colored, which can be made, or the impurities can be mixed so as to match the color of your teeth. And it sets by light activation, exposed to the light. Glass isomer cement, GIC. It is a cement restoration and has a wide appearance, glossy appearance. And then there is amalgam. Usually this is used most of the time. It is more sturdy than composite and GIC cement. Glass has ionomer cement, but its appearance makes it a questionable choice because this have a different color than the natural coloring of your teeth. That's why makes it a questionable choice. But this is cheap, so most of the people have amalgam, and at that time we don't know what our dentist is choosing for us. And of course, the dentist also needs to save money. That's why they use amalgam. And then there is zinc oxide cement. This is mostly used as a temporary restorative material and has a low strength. So if you want to use over the counter, one of them is zinc oxide cement for the temporary closure of the teeth. Perfect. So now we go for the endodontic therapy, which is also known as root canal treatment. Endodontic therapy, also known as root canal treatment, is recommended if the pulp in the tooth dies from infection by decay causing bacteria or from trauma. So pulp is gone. So now pulp is destroyed, nerves are destroyed, the basic tooth is It's almost non-vital. So now we go for endodontic therapy. Endo is inside, dontic or don is teeth. So inside teeth therapy, also known as root canal therapy, commonly known as root canal therapy, RCT. How it is performed? Let's see. During a root canal, the pulp of the tooth, including the nerve and vascular tissues, is removed along with decayed portions of the tooth. So we do irrigation, we remove the nerve, we remove the vascular tissue, vessels, and also the decayed portion of the tooth. The canals are usually filled with a rubber-like material called gutta percha. So we use gutta percha, the rubber-like material, to fill the canals so that teeth, the root of the teeth has still some structure so that it can still remain in the teeth. If this is too small, the rubber is too small, too thin, the teeth is dead, it can come out. So that's why we fill it with this rubber-like material. The tooth is filled and crown can be placed. After that, the pulp, dentin, and enamel portion outside, we fill it with some amalgam, composite material, and then after that, a crown is placed, which is an artificial cap to avoid it from external chemical or physical abrasion or damage. Upon completion of the root canal, the tooth is now non-vital. It's dead. The tooth is dead and it is devoid of any living tissue. So there can be no sensation. And if some patients say they still have some sensation, it's because of the neighboring teeth. Their adjacent teeth have still some problems, not because of this, because the nerves are gone, vessels are gone. Vessels are gone. If there is some damage inside vessels, there are no vessels, there can be no inflammation, and nerves are gone, there should be no sensation, no pain. An extraction. Now finally, an extraction. If the teeth are too bad in condition, so severe, then an extraction can also serve as treatment for dental caries. The removal of the decayed tooth is performed if the tooth is too far destroyed from the decay process to effectively restore the tooth. So now we have causes and treatment. Left side causes already studied, right side treatment already studied, and this is for revision for you guys. And then how to prevent, the most important part of the lecture, how to prevent the dental caries. Brush teeth, floss daily, eat healthily, visit dentist, use a mouth rinse, chew sugarless gum. Yes. So brush teeth. It is essential that you brush your teeth properly and at least twice a day with toothpaste containing fluoride. Floss daily. Food debris gets caught between our teeth when we eat. If the debris is not removed, it can lead to cavities. Flossing every day is the best way to remove food debris from between the teeth. Eat healthily. Proper nutrition plays an important role in good dental health. Eating nutritional snacks and limiting the number of sugary drinks will help to prevent plaque, calculus from forming on the teeth. Okay, so proper dental care on the right side. Brush your teeth daily twice a day, morning and evening. Okay, brush your teeth for at least 2 to 3 minutes so that fluoride elimination can occur. Use dental floss. Use a toothbrush of medium hardness, not too hard, not too soft. Use a tongue scraper. When brushing your teeth, use toothpaste. Use tooth rinse or mouth rinse, and cleaning the inner surface of teeth is required. So all of us should know how to clean our teeth properly. What is the proper way for brushing our teeth, because we may have to teach some of the our patients during oral hygiene instructions. Then visit dentist. Many cavities can only be detected by a dentist or dental x-rays. So visiting the dentist for regular checkups for maintenance of healthcare, and cleaning is a key factor in preventing cavities and staying on the top of good oral hygiene. Definitely use a mouth rinse. Rinsing with one of the mouth rinsers after brushing or eating can aid in cavity prevention. And also, if the gums are swollen, mouth rinser helps a lot. And then definitely chew sugarless gum. Believe it or not, chewing certain sugarless gums can actually help to prevent cavities by increasing the flow of saliva in the mouth, because saliva protects cavity. And then gums create more saliva, vice versa. They help to prevent caries. How to prevent caries? This is the same as before, but this guy, that there were no cavities, and now we have dental caries. So twice a year to carry out professional hardware brushing. So every 6 months you should go for a visit to a dentist, and daily oral hygiene, use tooth rinse, mouth freshener, mouth rinser, visit your or mouthwash, visit your dentist at least twice a year, same thing. And then reducing the consumption of carbonated drinks, sugary drinks, and food that contain a lot of harmful carbohydrates, especially sugars and sucrose. Do not, why sucrose and sugars, carbs? Because bacteria love that, and they change, they eat, they use it and change into acid, which is harmful for the teeth. Do not eat too cold and hot food immediately. Replenish fluoride deficiency using highly enriched fluoride toothpaste, and use dental floss to avoid the unnecessary food particles or debris to stuck in the mouth and cause halitosis and tooth decay. So we have non-restorative management that is also important. Excuse me, you can see on the left side there is non-restorative management of dental caries. To plaque control, for the control of the plaque, these are the etiological factors. The risk factor of dental caries: dental biofilm should be intact. Reduction of risk level is by inadequate diet, hyposalivation, inadequate oral hygiene practice, susceptible dental anatomy, and inadequate fluoride exposure. If we have inadequate these, then there are high risk factors for this, and we need to reduce these factors for the non-restorative management, initial management, or prevention. Preservation of dental tissue. We need to preserve dental tissue. Okay, what's the problem? What are the factors? Susceptible dental tissues and inadequate fluoride exposure. So brush your teeth with a good toothpaste. Don't save money on the toothpaste. And then long-term follow-up is sustainability of caries management outcomes over time. So you need long-term follow-up. If you are more susceptible to dental caries, you should visit your doctor more often. You should visit your dentist more often. So now we have our own visit to a dentist, and let's see who is there. Adil Sharif, roll number 35. Are you here?
Yes, sir, I'm here.
Okay, can you tell us some definitive treatment, some steps of the definitive treatment?
Yes, sir. So okay, we can use anesthetic, sir,
yes,
for the pains. Nitrous oxide, another medication we require.
Okay.
And we can use the dental drills for the removal of the large portion of decay material.
Okay, perfect. Okay, thank you so much. Thank you so much. So now we go for Aisha Zahir, roll number 42. Are you there?
Yes, sir.
Okay, can you name some of the restorative material used for the filling of dental caries?
Sir, dental amalgam, resin, porcelain, and gold. So dental amalgam and resin we use because they give the same color of the tooth, and the other.
Yes, perfect, thank you. And do we have Nasir, roll number 59?
Yes, sir.
Can you tell us what is the other name of endodontic therapy?
Root canal, yes.
Perfect. RCT, root canal therapy. Okay, do we have someone else? Do we have Adnan, roll number 08? Adnan, 08. Okay, so do we have Maham, roll number 46? It's something wrong with my connection. Roll number Farooq, roll number 6.
Yes, sir.
Okay, can you tell us some of the, what is Ludwig's angina? Can you tell something about Ludwig's angina and how it is related to caries, tooth caries?
Sir, respector as a carrier tooth cancer of the oral cavity.
So it is a cellulitis, it's a kind of cellulitis. And
Yes, sir.
one of the risk
Connected
factor,
to
yes, one of the risk factor of Ludwig's angina is dental caries. Okay, good.
yes.
Okay, so we will stop our class here, and we have finished almost half of our syllabus. And from the next week, we will be going towards more pathological part of stomatology, an important part. So we will be going some aggressively towards that, and we will have an aggressive approach and a speed up approach towards that. So see you next Monday, and I'll be giving assignments soon. So take care until then. Okay.
Thank you, sir.
Any question from anyone? Any question from
Sir.
anyone? Now is the time. Maham is
Assalamualaikum.
here. Okay.
Yes, sir.
Walaikum
I'm
salam.
here.
Okay. Okay. So any question from anyone? Now is the time.
Yes, everything's clear, alhamdulillah.
Okay. Alhamdulillah. Okay, perfect. Let's end our session here. See you guys on Monday, inshallah.